good to be with you tonight. Most people living in adult homes, I dare say, don't have family or friends, and they're pretty isolated. Surf Manor, many of the adult homes, adult care facilities in New York City are in very marginal places. Coney Island, many of them in the Rockaways, where there's cheap housing. Surf Manor is one of 80 adult care facilities in New York City, and adult care facilities house a very diverse population of people, and it can get pretty confusing if you start getting into the weeds. They have different names, but there are assisted living places. We sometimes think of them as senior residences. The Sunrises, some of them are catering to a more private pay population and an elderly population. A place like Surf Manor has a large population, majority of people with a diagnosis of a mental illness. These adult homes back in the after World War II, they were mom and pop operations. They were the first assisted living facilities. They were basically taking care of older people who didn't want to or couldn't support themselves any longer. And then in the mid to late 60s, New York State, along with other states throughout the country, began what everyone thought was a benevolent policy decision to deinstitutionalize our psychiatric hospitals. And unfortunately, the money didn't follow the people as we began downsizing the hospitals. And that partly led to the psychiatrically disabled homeless population that we still see in New York. Basically, as I understand it, New York State approached these adult home operators who didn't have any training or skills to be working with this particular population to see if that could be a housing resource for them. So many of these places started housing a younger population of people with mental illness. And those are the homes, not all of the 80 are homes like this, are the homes that my organization, the Coalition of Institutionalized Aged and Disabled, focuses on, because historically those places have been the places with the most terrible conditions, both in terms of physical plant and treatment of folks. So I'm not an expert when it comes to some of the other places, especially in Manhattan. I'm going into 2 or 3 places in Manhattan, but not a place like Village Care at 46th Street, or the Lot Assisted Living Residence further uptown. There are a couple of different housing models. The place where Alejandro lives at Surf Manor is, from my point of view, very much an institutional setting. People are living in semi-private rooms. They're sharing bathrooms. We've been talking about nutrition, and I'm going to say that most adult homes, from what I've been able to gather, are spending about $5 per day per resident on food. If you can imagine that. Basically adult homes have been a cheap housing resource that New York State has used to house parts of our citizenry that we haven't known what to do with. And it's a real shame and a real problem in how people are living. So the Coalition of Institutionalized Aged and Disabled, we've been around for a long time. I'm basically a community organizer, and I cut my teeth when the organization was originally organizing nursing home residents. And you should know adult homes are not nursing homes. They're not group homes that we refer to who are housing people with developmental disabilities. CIAD was originally founded to try and give back the independence and decision-making power and control that people lose when they move into an institutional setting. like Surf Manor or like a nursing home, since they're institutions. I don't know how much you're aware, but the effects of institutionalization can be devastating, where you learn how to become helpless. If Alejandro ends up spending a lot of time at Surf Manor, where he's not doing for himself, he could learn how to be helpless, how not to help himself. And I think what John is helping Alejandro do, and what CIAD has tried to help residents over the years, is to, in social work jargon, empower them, provide people with the skills and information that they need so that they can advocate for themselves and better their lives in a variety of ways. So we do that by educating people about their rights and about the obligations that adult homes have to provide them with the care and services that New York State regulations set forth in New York State law. We organize residents into resident councils, which are something very much like tenant organizations, in which we're bringing residents from throughout the home together to try and work together to raise issues and try and come up with solutions on how to solve those problems. And it's very, very difficult work. Any resident who sometimes dares to complain to adult home staff or to go outside of the facility to maybe a guy like John or to us at CIAD or to the New York State Health Department, they may get intimidated by the staff, called on the carpet. Why are you complaining? Why are you causing a ruckus? Why didn't you come to us? So it's a very, very tough deal. So we're working with residents in groups. We're also trying to work with them on an individual basis. If they come forward with complaints, individual concerns. And we're also organizing them on a more systemic level, bringing residents together from different homes to craft a public policy agenda, a social policy agenda. Just like I think you're doing here amongst yourselves, that's what we're trying to do with adult home residents and what we've done for many, many years. On March 15th, we'll be bringing a busload of residents to Albany for our lobby day and fighting for a variety of important issues, including an increase in their personal needs allowance. I don't know Alejandro's financial situation, but if he's getting $198, Alejandro, like many adult home residents, are entitled to SSI, Supplemental Security Income. And with that, the large majority of their SSI check or checks is going for their rent in the home. Alejandro's check is about $1,440. He's handing over about $1,235 or $1,240 to Surf Manor. And as John said, he's keeping $198 for his own personal use. And we found out not that long ago that the operators got the New York State Legislature to pass 2 bills that would provide them with a very, very steep increase in their SSI rate that they could charge residents. And the first thing that we thought of is, well, if New York State is going to provide an increase to operators, the very least that we as a state can do is provide fairness and equity to residents and give them an increase in their personal needs allowance. And that's become our #1 priority during this state budget and legislative session. And you can certainly help by getting in touch with your assembly person and senator and supporting residents' efforts in doing that. In talking about food, that $5 per day on average that we think is being spent on food. One of the major complaints that residents have is how bad the food is. Talking about the importance of nutrition and health. Many adult home residents are diabetic, and they're getting a diet largely of carbohydrates. One of the things they talk about most in resident councils and food committee is how to improve the food, that they want more fresh fruits and vegetables. Although the personal needs allowance was never really designed to do this, they're getting 3 meals a day. Many residents who I meet are spending large portions of their personal needs allowance on outside food. They're going out because they can't eat the food in the facility. So I'll end with this. The Coalition of Institutionalized Aged and Disabled has 2 major goals. We've been talking about the first goal in more detail this evening. That is trying to improve the quality of life and care of residents living in the adult homes. But there's some other very important work that we've been doing, and that's trying to provide our residents with access to living more independently and integrated into the community. And over many years, there was a lawsuit and that went to a federal court. A group of lawyers, including Mobilization for Justice, legal services outfit that CIAD works very closely with, brought a suit against New York State, claiming that New York State violated the Americans with Disabilities Act because they weren't providing people with mental illness with the most integrated housing and services that they could provide. And right now we're going through a process where adult home residents living in a certain class of homes, including Surf Manor, have the opportunity to move out into their own apartments. And there have been some problems with the implementation of the rollout of this program, but so far a little over 600 people have moved into their own apartments, and for the most part it's been working out magnificently. So in the case of Alejandro or other people who have a diagnosis of mental illness, if he chooses, may have an opportunity to move into an apartment that he can call his own. The important thing about this housing program is that you're not only providing people with a roof over their heads, but with very rich services. So any adult home resident who needed mental health or health services, needed an aide to come in, the housing contractor and the managed long-term care plan that typically is partnering with the housing contractor with devise a program of services for an individual. I think we all need to be very concerned about what's going to happen, and I'll say on a federal level, because people on SSI, they're on Medicaid, okay, and Medicaid services are under attack. New York State has been one state that has taken terrific advantage of the Medicaid program and the kind of services that we're providing for people, and I think it's very worrisome down the road on what's going to happen. The apartments that the scattered site apartments that people are moving into are apartments that other New York City citizens are living in. They're integrated into the community. They aren't separate congregate living situations that are only housing elderly people or people with mental illness. So that someone like Alejandro could move into a building with young families, elderly folks, and the housing contractors who are helping to support these people or nonprofit organizations. When we talk about adult homes, adult care facilities, the large majority of adult homes are for-profit outfits. There are some not-for-profit adult homes, particularly in Manhattan, if you look at the list. But the large majority, like Surf Manor, are for-profit places. There should be more oversight about how the money is being spent. I think that too often, if you were able to look at the budget of a lot of these places, a lot of it is going to administrative costs and not enough to providing the direct services that residents are receiving.
Geoff Lieberman, everybody.
All right.